Testing, 1, 2, testing.
We do have a quorum, I believe. Yes. Okay.
Skin of our teeth.
Yes, we do. The Finance Committee meeting.
Call the Finance Committee. Once I turn my microphone on. Good morning, everyone. We're going to call the Finance Committee meeting to order at this time. Any questions, concerns? At this time, I adjourn the Finance Committee meeting.
Well, we need to get a motion to approve the
Oh,
minutes.
I forgot. I have one action item that does need to be approved. Can I get an approval?
Move to approve.
Can I get a second? At this time, we'll adjourn.
My microphone on. So I'd like to call the Juvenile Welfare Board meeting to order. First order of business is to welcome our latest member to the Juvenile Welfare Board, Commissioner Lafala. We really look forward to having you join us and participating, as we know you have had a focus on children for your entire life. And we expect to see a lot of great things from your support and a lot of good direction. With that, would you lead us in the Pledge of Allegiance?
I pledge allegiance
To the flag
of the
United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so let me switch places a little bit here, and for a special award, the GFOA Award. For the third year in a row, JWB's accounting team was awarded the GFOA's Certificate of Achievement for Financial Reporting. This was for the FY21 JWB Annual Comprehensive Financial Report, which you can find on our website on the Budget and Financial page. Last year was the third time ever receiving this award, which is considered the gold star in financial reporting. The GFOA, or Government Financial Office Officers Association established a Certificate of Achievement for Excellence in the Financial Reporting Program in 1945 to encourage and assist states and local governments to go beyond the minimum requirements of generally accepted accounting principles. It encourages the preparation of annual comprehensive financial reports that evidence the spirit of transparency, full disclosure, and then recognizes individual governments like ours that succeed in achieving that goal. Please join me in congratulating the accounting department, led by Senior Manager Lynn Delatorre, her team, Richard Godfrey, Senior Accountant Ann Crawford, Accountant, and Julia, and I apologize, Plentive as a Fiscal Specialist. Would you please like to join me here?
Thank you.
Congratulations.
Thank you.
Thank you. Ready? 3, 2, 1.
Thank you. Thank
Would you
you.
like to say anything?
Really just to thank the team. Without Lilia, Richard, and Ann, it wouldn't be possible. They're just a great team to work with, and I really appreciate them. Thank you. And also Laura Brock for her leadership. Sorry.
Once again, thank you. Okay, having in front of you the consent agenda, or consent items. I assume everyone has had an opportunity to review them. Do I have a motion to approve?
So moved.
Second.
I have a motion and a second. All in favor, say aye.
Aye.
Those opposed, same sign. Motion's approved. Action item A, update on children's mental health initiatives and approve new position to support expansion. Rebecca?
Good morning. I'm Becky Albert, Senior Manager for Strategic Initiatives here at JWB. Today, I will be presenting with Dr. Jennifer Katzenstein, who is the Director of Psychology, Neuropsychology, and Social Work for Johns Hopkins All Children's Hospital. Dr. Katzenstein also chairs the Children's Mental Health Initiative Workforce Design Team. So after hearing about recent trends and how the pediatric hospital is responding, she will outline the most pressing areas that our design team has prioritized in order to address the ongoing need for an engaged and skilled workforce. If you can believe, it'll be 5 years this May from when JWB convened a group of partners which led to the development of a shared vision for children's mental health. About a year later, in August of 2019, we entered into an agreement with Evra Health to integrate behavioral health and support services into its pediatric practices. 2 years after that, October of 21, we added a second entity, North Pinellas Children's Medical Center, which some of you may recall attending the ribbon cutting ceremony. Which brings us to the present day, where I'll be sharing 3 years of data consisting of the initial implementation of the integration of services within Evra Health, combined with the first year of integration from North Pinellas Children's Medical Center. So just a quick refresher that the integration of services within pediatric practices is both clinical and non-clinical staff. Often this team of professionals are tasked with various activities that are patient and family-centered. They're practical, effective at helping children from a prevention and early intervention perspective. So highlights from year 3. Well, the big win, in my opinion, for our community was executing an agreement with North Pinellas Children's Medical Center and having Evra Health support to guide the process based on lessons that they had already learned. So last year, in year 3, more than 6,600 children were screened for adverse childhood experiences. More than 1,500 children were supported through care coordination, meaning that they were linked to a referral or a service within or outside of the pediatric practice, and staff were monitoring the referral until the actual linkage or connection occurred. Nearly 1,400 children had one or more visit with an integrated therapist. And what I think that we really need to be paying close attention to, which I've circled there on the slide, is that by having an integrated team within pediatric practices, nearly 500 same-day crisis interventions occurred. So one of the most significant enhancements to our system has been the ability to provide same-day services. In particular, same-day crisis interventions, which are often initiated by the pediatricians for situations that need more of an immediate response. Situations ranging from a child exhibiting concerning behaviors to parenting challenges related to age-appropriate consequences, for example. Situations that, if ignored, may have resulted in the need for deeper end services. So the number of appointments and visits continue to increase year after year. And with more than 4,600 visits occurring with integrated therapists within the pediatric setting, just as a reminder, in year one, we were just starting to take off. We had recruited and hired staff, we were training, getting in place, and then boom, the pandemic arrives. It created a lot of unanticipated challenges, and so that is life, right? But we began to pivot, and so in year two, EverHealth began developing the infrastructure that was needed to to provide telehealth services. And meanwhile, people were getting sick, offices were closed, and there was a heightened anxiety due to this unfamiliar space that many of us found ourselves in. However, our partners continued to adapt and moved forward. And in year three, we were adjusting now to the new norm. Families were learning that there was a support system available to them within the pediatric practice. And with the number of same-day visits growing, we had a 30% increase in year three of same-day visits when you compare it to the year prior in year two. But obviously, even with an increased availability to behavioral health services, barriers extend beyond the scheduled appointment. With our engagement rate at 57%, the team has been working on improvements, including reducing the wait time for a scheduled appointment. They're automating appointment reminders, and they're utilizing the motivational interviewing when connecting with patients so that they can better understand some